My name is Nicole Harris, and I am doing my Community Needs Assessment presentation. The purpose of this needs assessment is to explore pregnant or postpartum teenagers who are currently receiving secondary preventative in-home support, analyze Arizona's current in-home initiatives available, and gather data to better understand the needs of Arizona's teen parents. The issue identified is the need for increased funding for individualized in-home support services so that Arizona's pregnant teens and their families can overcome and be successful despite the disparities they're facing. The agenda includes data collection, the interview process, findings, recommendations, and my reflection. Data collection first began with the literature review. According to the American Pregnancy Association, teen pregnancy occurs under the age of 20 years old. In 2017, teenage women gave birth to over 200,000 babies per the U.S. Department of Health Services. Teenage pregnancy is increasingly likely if a woman is exposed to the following disparities: low education, single-family household, and growing up in poverty, just to name a few. Additionally, teens that are involved in foster care are more than twice as likely to become pregnant before the age of 20 years old. Teens are more likely to receive inadequate or no prenatal care than older women and therefore are at special risk for poor pregnancy outcomes. The effects of teen pregnancy on her child include the risk of poverty, low education, single-family household, all of which are non-coincidental health disparities from the original onset of teen pregnancy. Therefore, having teen parents increases the chance of also being a teen parent. This is a generational impact. This is why stopping the cycle of teen pregnancies is one of the CDC's top 7 priorities. ADHS, Access, and the REBAs, alongside DCS, have made collaborative attempts in Arizona to help contribute towards the decreasing teen pregnancies. The goal was to identify and collaborate among groups to produce effective programs that meet the biological, social, and psychological needs of teen pregnancy, thus creating generational change of decreasing pregnancy rates and increased rates of positive, healthy, successful parenting. The interview sample selection process was initially intended to include samples from 2 of the more commonly known initiatives, Arizona Health Start and Arizona Healthy Families, to discuss in-home support. I was also aiming to interview Cradles to Crayons and other nonprofit pregnancy centers. However, after multiple attempts and a lack of response from some of the identified providers, I also made outreach to the following agencies on the right, who also have a role in working with teens, pregnant teens, or sometimes even their babies to gather a more collaborative approach. I was really hoping to have the Ujima House be a part of the needs assessment, as they are a group home for teen parents that I've had clients at in the past, and I've worked collaboratively with them, but unfortunately I wasn't getting a response back. However, I was able to connect with 3 providers within the field who are contracted with Health Start and Healthy Families. Thankfully, this means I was able to complete 2 of my 3 initial selections. The Health Start worker I interviewed has been supporting families professionally for over 10 years after she herself was a client at the agency. Because of her hard work successfully navigating the system, she was brought onto working at a professional level to continue the advocacy for parents. Since then, she's been Health Start certified and trained. I also interviewed her program manager, who has a dual MPH and MSW degree, and a professional experience working and educating the community on pregnant and postnatal families. She specializes now within the birth to 5 population and has been licensed as an LMSW for 6 years. The Healthy Families FSP I interviewed also has a slew of personal experience in which she's been working professionally advocating families for the past 5 years through a contract with DCS's Healthy Families. All interviews were conducted face-to-face, The interviews helped me identify the inner workings of the state programs and the needs of their clients who they are working with daily. These are some of the interview questions that I had used. After interviewing 3 providers from 2 differing contracts, I was able to identify some similarities between the contracts, which are the following. They're both voluntary programs. An intake is completed to assess for the need, and the intake or the need are not dependent on one's health insurance or their income level. Next, an FSP is assigned, and frequent home visits occur that revolve around a curriculum dependent from the intake. The topics discussed range from prenatal care, postnatal care, living skills, creating healthy habits, and providing emotional support for the families. During these home visits, FSPs are completing assessments, like the Ages and Stages questionnaire, and assessments to analyze for postpartum depression. The FSPs are also providing emotional support and helping the clients navigate the system through collaboration with other providers such as a high needs case manager, a CFT, a DCS case manager, daycares, and even OBGYNs. The goal is to stay enrolled in the family as long as the family prefers, but ideally beyond infancy. Here are some of the statistics taken from the most recent annual reports that were provided to me. On the left, for healthy families, there's a significant improvement from the intake of a family's ability to gain tools and a skill set of wide array of support. On the right, for Health Start, the statistics of healthy pregnancies include gestational age and prenatal visits attended are increased, determining that there are, in fact, behavioral changes amongst their clients. The data analyst suggests that in-home visitation services are effective at increasing positive parenting behavior, and though there is low funding, there are still areas of improvement. The recommendations from the 3 interviews are unanimous. Programs are currently on a first-come, first-served basis due to a lack of funding. The interviewees would all like to see increased community preventative measures to discourage the need for programs such as these. During the interview and intake, more analysis should be done regarding the teen sexual history and sexual education, and to improve the current curriculum, the FSPs would like more of an emphasis available on teen fathers, teens with unsupportive parents, teens in congregate care, and further collaboration with stakeholders like OBGYNs, daycares, and substance abuse providers. Improving the assessment procedure on a prenatal and postnatal level to further document and track successes, and looking into other models that are utilized in the United States that have healthier pregnancy outcomes and dropping rates of teen pregnancy, especially community efforts and group supports. Overall, in-home visitation services are beneficial throughout pregnancy for all women, but especially teenage women. From the needs assessment, I have become more involved with teen parents and have been assigned to a handful of pregnant clients onto my professional caseload. I have shared my presentation with the interviewees and aim at sharing this presentation and research with any various stakeholder. I've also began to work alongside 2 of the interviewees to create a teen parent support group. Throughout the group process, I aim to receive feedback, adjust accordingly, and fine-tune the program to the needs of the individual and, most importantly, the community. Overall, I had a pleasant experience working collaboratively with all the programs prior to the community needs assessment. I have a public health background with an emphasis on health prevention and promotion, which allowed me to collaborate, collect, and analyze data. Additionally, my current role within the behavioral health field has helped me provide myself with opportunities to interview and connect through years of networking. I did, however, have some barriers, including difficulty narrowing down my needs assessment topic. The short 8-week period of the class really impacted my ability to interview thoroughly all the sites I wanted. However, the needs assessment has further solidified my strong views of providing individualized treatment that meets the needs of the families where they're currently at, and that the field of helping people, we cannot do this alone, and collaborative efforts are the most important tool. Thank you so much.